Live, the morning show from KPSP Local 2, where local comes first.
When you look in the mirror these days, do you often notice maybe a little bit less hair on your head? I experience that occasionally. Hair loss is common, but there are ways to restore your mane, apparently. Joining us this morning to tell us what works is board-certified dermatologist Dr. Timothy Jochen. Dr. Jochen, welcome. Great to see you this morning.
Good morning. Thanks for having me.
You got it. Let's talk about hair loss a little bit and how common a problem is this for people today.
Well, most people, having a healthy head of hair like yours, it makes people feel confident, look youthful, and also makes you look more attractive. So people start to panic when they start to see that their hair is falling out. Now, the average person has about 100,000 hairs on their head, and they don't notice that they're losing hair until they've lost about 50% of that. So people come in panicked and they tell me that they're losing all their hair. Well, people lose on an average 100 hairs per day.
I guess we can attest to that sometimes when we look in the bottom of our showers, right?
Right.
What is the cause of hair loss? I mean, why does this happen typically?
Well, the most common cause of hair loss in both men and women is what we call androgenetic alopecia, and that just means you inherit the trait to lose your hair. And this occurs in 95% of men and in about 90% of women.
And the patterns apparently are different for men and women as well, as far as how and exactly where the hair falls out.
Exactly. The difference is the extent and the pattern that men and women lose it. Men tend to lose more hair, and it tends to be in the temporal area and also at the top of the head, whereas women tend to lose it in a more diffuse area with the greater extent of it at the top of their head. But women won't go completely bald like men do in most cases.
Okay, and on the market today, there's all kinds of solutions and offerings. Can you talk a little bit about maybe some of the non-surgical options that are available for treatment?
Of course. Losing your hair is so stressful for both men and women, and I see men and women every single day in my office that have concerns about this. So there are really only 2 FDA-sanctioned products out there that have been scientifically proven to work. And the first one is Propecia, which is a pill, and this one is only available for men. And the second one is a topical solution called Rogaine, and that comes in a 2% and a 5% solution. And that's really the only one that's been proven to work for women. Now, both of these products do 3 things. They stimulate hair regrowth, they prevent hair from falling out, and they also thicken your hair so it makes it look like you have a fuller head of hair.
Now, if someone needs to maybe take a step further, there might be surgical transplant type options. When should someone consider that as an option, and who would be really the best candidate for that type of route to go?
Well, anyone who's really experiencing stress from losing their hair is a candidate for hair transplantation surgery. In order to be a real candidate, though, you have to have a strip of hair on the back of your head that's available. This is the donor area for people, and almost everybody has this donor strip. And it's interesting because this strip of hair is resistant to hair loss. The only people that are really discouraged from having a hair transplantation are people that have really extensive hair loss, where they have just a teeny strip of hair on the back of their head, or really young people, because if you're really young, under the age of 25, we're not sure the extent to which you're going to lose your hair. So what we could do in a person like that, if we were to transplant them, is they would have islands of hair that's been transplanted in a sea of baldness. So I like to get those people on products and pills first to try to prevent their hair loss and also stimulate some growth before we actually do a transplantation.
Okay, terrific. Lots of interesting information to think about today. Dr. Timothy Jochen, a board-certified dermatologist in Rancho Mirage on Highway 111. Thanks for joining us this morning. That was very interesting information. We appreciate it.
Thank you so much.
You got it.